Assalamu alaikum. Today I discuss elbow joint. Elbow joint is the hinge variety of the synovial joint. It is a uniaxial joint. It's moved along a single axis and specially facilitating flexion and extension movement only. It acts in the sagittal plane of the body and it's look like the auto gear of the motor car. This is the other example of the hinge variety of the synovial joint, knee joint. This is flexion, this is extension. Interphalangeal joint, this is extension, this is flexion. Ankle joint, this is dorsiflexion, this is plantar flexion. The articular surface of the elbow joint, the superior articular surface is formed by the trochlea and capitulum of the lower end of the humerus, and lower articular surface is formed by the trochlear notch of the ulna and head of the radius. The ligament of the elbow joint, capsular ligament, the proximal attachment, it is covered lower end of the humerus, excluded the two epicondyle, medial epicondyle and lateral epicondyle, and it includes three fossae, the coronate, radial and olecranon fossa. The distal attachment along the margin of the trochlear notch of the ulna and annular ligament, radial and ulnar collateral ligament. This is the capsular ligament of the elbow joint and this is annular ligament. Annular ligaments surround the head of the radius and attach to the ulna on both sides of the radial notch. It holds the radius in the radial notch of the ulna, allow it to rotate smoothly during pronation and supination. This is quadrate ligament extend from the radial notch of the ulna to the neck of the radius. It helps stabilize the proximal radioulnar joint. Oblique cord. It runs diagonally between the ulna and radius below the elbow joint. It provides additional stability to the proximal radioulnar joint. The ulnar collateral ligament. It has three band, anterior band, posterior band and transverse band. Anterior band is extend from the medial epicondyle of the humerus to the coronoid process of the ulna. The posterior band is extend from the medial end of the humerus to the olecranon process of the ulna. The transverse band is originate from the coronoid process to the olecranon process. Ulnar collateral ligament of the elbow is essential for maintaining medial stability, preventing the valgus stress. Its anterior band is most crucial part, resists stress during full extension, while the posterior and the transverse band resist stress during flexion and help with joint alignment. Proper care is necessary to prevent ulnar collateral injury, especially in athletes involving in throwing sports like tennis players are prone to ulnar collateral ligament injury due to the repetitive stretch on this ligament. The radial collateral ligament, it gives stability of the lateral side of the elbow joint. The nerve supply of the elbow joint. Elbow joint is supplied by the radial nerve and it gives nerve supply to the posterior and lateral capsule. The median nerve supply the anterior capsule and the ulnar nerve supply medial capsule and musculocutaneous nerve supply the anterior capsule. Blood supply of the elbow joint. The main blood supply of the elbow joint is the brachial artery, radial artery, and ulnar artery. And there is some artery arise from this artery, and they make a anastomosis around the elbow joint. From brachial artery, from profonda brachii artery, give rise the radial collateral superior radial collateral artery supply posterior structure of the elbow, then superior ulnar collateral artery which join with the posterior ulnar recurrent artery. The inferior ulnar collateral artery joins the anterior ulnar recurrent artery. Collateral artery is descent, recurrent artery is ascent. There is a posterior recurrent artery and anterior radial recurrent artery. The tips to remember anastomosis: collateral artery come from above, superior inferior ulnar collateral artery, and recurrent artery came from the below. Now the venous drainage of the elbow joint and related vein around the elbow joint. The superficial vein, cephalic vein, basilic vein, medial cubital vein, and median antebrachial vein. Deep vein, brachial, radial, and ulnar vein. So these are the superficial vein, basilic vein, cephalic vein, and medial cubital vein. This is the median antebrachial vein. These are the clinical importance of the venous system around the elbow: venipuncture site, IV cannulation, superficial and deep venous thrombosis, and collateral circulation. So this is the deep vein of the which pass along the in front of the elbow joint, the brachial vein, ulnar and radial vein. These are the venous anastomosis around the elbow joint. The radial collateral, ulnar collateral, and profunda brachii artery and vein is follow this artery. Vein also follow the radial and ulnar recurrent artery and connected with the brachial vein. The muscle responsible for the movement of the elbow joint. This is biceps brachii. It has two heads, and this muscle is cross two joint, shoulder joint and elbow joint, and the origin of this muscle is face insertion work move. So direction of the movement or contraction of the muscle is toward the origin, and it causes the movement flexion. So these are the muscle which causes flexion of the elbow joint: biceps brachii, brachialis, and brachioradialis. This is triceps. This is the long head. This is the lateral head, and green one is the medial head. This muscle causes extension of the elbow joint. This is anconeus, origin from the lateral epicondyle of the humerus inserted into the olecranon and posterior surface of the ulna. This is the biceps brachii muscle, brachialis muscle, and this is the brachioradialis muscle crossing the elbow joint. So this is all about elbow joint. If you find this video helpful, please like this video. Please follow me and subscribe my channel. Thank you for watching.